I'm Dr. Rachel Langley with Pine Ridge Family Medicine, and one of the topics that I used to talk about all the time during residency when I was delivering babies was circumcision. I don't have the conversation quite so often these days. I don't get to help many moms deliver their babies and then decide about those early days, big decisions to make. But I still like to talk about it when parents have questions, so I thought I'd put this out there just in case any of you have questions. So, it's a good conversation to have way before you're delivering your little baby boy. If you don't know what you're having, then it's a good thing to discuss about with any other parents that you're co-parenting with this new little baby about what you want to do about circumcision. In America, it's very common to be circumcised. I spent some time in Germany where I believe it's actually illegal to be circumcised or to circumcise your baby. So I've definitely been exposed to some varieties of cultures regarding it. So it's something to have already thought about and considered the pros and cons and had these important discussions with beforehand. Because it's not really a last minute decision to be made. So circumcision, no matter who you're talking about, it is considered an elective procedure. It's not a requirement. There's not any medical organizations out there that recommend circumcision be done unless the parents desire it. So take that for what it's worth. It's an elective cosmetic procedure. So there's some medical benefits for sure, but they're not so solid of benefits to say, yes, this is absolutely a good thing to do for every little boy. So what are those benefits? One of the clear benefits is that it seems to reduce the risk of UTIs, especially for little boys in the first 6 months of their lives. So little babies getting UTIs. Honestly, men don't get UTIs that often, but those that get them, they can be more serious than UTIs in women. They're more unusual. There's more workup to be done to make sure there's not something else going on. So this can reduce the risk of that happening. It reduces the risk of certain penile cancers, but penile cancers are pretty rare as it is. It also reduces your risk of some STDs. So it seems to reduce the risk of HPV, and especially HPV being passed to female partners and causing them to have possibly cervical cancer, that sort of thing. So that's cool. It doesn't seem to have an effect on the most common STDs, like gonorrhea or chlamydia. Also doesn't seem to have an effect on syphilis. But it does seem to reduce the risk of HIV and HPV and HSV or herpes herpes simplex virus. So some benefits there, and it does decrease the risk of certain retractile disorders. It can happen where the foreskin actually gets kind of swollen or stuck due to an infection or other irritation or inflammation, and that's a painful thing that can happen. And so if you don't have that foreskin, if it's been cut off, if it's been removed, then that's not a possibility anymore. In general, it seems to be easier for hygiene-wise, especially for little boys that don't know that they need to pull back their foreskin in the shower and wash that whenever they take a shower. It's not something, if you're thinking about that for your little boy, your infant or toddler, it's not something that has to be done every time. Most little boys aren't able to pull back their foreskin all the way. And that's completely normal and healthy, and pulling back on it a lot can cause trauma and pain, and it's a bad idea. So gentle retraction, absolutely, when you're bathing or changing a diaper, totally a good idea. And then after it is able to be retracted, then every time bathing or showering, pulling it back and washing. So as for risks of having your baby circumcised, there's a number of risks, and a lot of them are true with any procedure. So a lot of the minor procedures that I do here in clinic include these risks. So there's risks like bleeding, and bleeding is extra scary in a little newborn baby, which is when most circumcisions are done. If there's generally the rule that I've heard is that if you see blood bigger than the size of a quarter in a baby's diaper, that's a reason to call their doctor, but be sure to have that conversation with the doctor that does your baby's circumcision to make sure that you're on the same page. There's also the risk of pain. Most circumcisions that I've seen and that I've done, we inject lidocaine, a numbing medicine, into the base of the penis to make sure that the entire penis is numb throughout the procedure. But it does seem like the babies are still just uncomfortable, so especially with the shots of lidocaine, those aren't comfortable. So usually I'll have a technician there with a pacifier administering a little bit of sugar water which seems to help with the baby's pain sensors in their brain, that it helps them to stay calm throughout it. There's a risk of infection. It's a clean procedure, but baby can poop or pee in the middle of the circumcision if they want. So we just consider it a clean procedure. We do the best we can to keep it free of infection, but infections do sometimes happen, and that's a very small and delicate area to get an infection in. It can definitely happen where what you imagine for a circumcised penis to look like isn't what the doctor has in mind, or maybe the doctor just didn't get quite the outcome that they wanted either. So that can happen. Especially with a cosmetic procedure, you can get a cosmetic outcome that's not what you had in mind. Or even if it goes perfectly, you can get little adhesions, little bits of skin attaching from the healing skin one side to the other. And those sometimes can be cleared up later in life. Sometimes they are just stick around and you don't like how they look. But that's a risk of healing even if you do everything perfectly. It happens. There's also the possibility of discovering abnormal anatomy as you're doing the circumcision. So you might be partly into doing the procedure and then realize that things aren't the way they should be, and that could lead to basically the circumcision being partly done, because we have to evaluate, well, we don't want to cause any further problems, so let's figure out what anatomy is supposed to be where, and maybe, for example, the urethra where the urine comes out is in not quite the midline right where you would expect it to be. So we need to stop, figure out what other anatomy might be slightly different to make sure we're not causing problems. And then there's also the possibility of what's called a degloving injury. So you can imagine your hand, if you were to take off your skin like a glove, that's a degloving injury. It happens in some awful industrial accidents sometimes, especially, and it can happen to the penis too, especially if people who are cleaning the penis after the circumcision are a little bit too rough. The skin can actually be pulled down, and that's a pretty serious injury that you need to come back in for. And so mostly just be very, very gentle as your baby is healing. As your baby's healing, make sure that you're smearing on that petroleum jelly, that Vaseline, whatever your doctor recommends, all over around that circumcision site with every single diaper change. It usually takes about a week to 10 days of healing for it to get the skin back and to be healed. So those are the risks and benefits of having your infant circumcised. Some people say, well, maybe I'll just let my child grow up and be an adult, and then they can decide if they want to be circumcised. That's a possibility too. There are more risks and more costs and longer healing for an adult to be circumcised versus a baby. So tough decision. Hopefully that helps guide your discussion, helps guide your decision-making process. If you're interested in finding out more videos like this, go ahead and click here to subscribe to our channel, and click here on another video that you might find interesting. Thanks for watching.